Good morning, students. Welcome back to Community Health Nursing. So, in the last class, we were discussing some of the social issues which can really affect the growth and development of a particular individual as well as the family. So, these all we are studying under the unit assisting individuals and groups to promote and maintain their health. So, in this whole unit, we are discussing regarding how we can assist as a community health nurse, how we can assist an individual or a group or a family or a community in order to promote and maintain their health. So in the last few classes we were discussing regarding the social issues. Already we have discussed regarding women abuse, child abuse, elderly abuse, regarding female feticide, regarding substance abuse, alcoholism, regarding the various aspects of women empowerment, the intrinsic factors or the barriers towards women empowerment. All these things we have already discussed. Today we are going to move into one of the next aspect in this particular unit, that is regarding self-care. So empowerment for self-care of individual, family and group. As we all know, whatever care we provide as a community health nurse, it is just secondary. The primary thing is the self-care. We should be able to take care of ourselves. For that, each individual and each family, they should have adequate knowledge or they should get proper guidance from the community health nurse to take care of themselves. For example, we should know how to identify the early dangers or the early signs and symptoms where we are varying our health. So, if we are going towards a illness, as a person, we should be able to identify ourselves. Yes, something is changing in my body. There is some mild discomfort. There is a slight variation in my temperature. I am having these type of discomforts. So, we should know how to identify all these things, as well as we should be able to know how to take care of ourselves. That is meant by self-care. So, in this particular aspect, when we study about self-care, first of all, the thing is we should be able to do the assessment and monitoring of growth and development. So if you are able to assess and if you are able to monitor the growth and development of your child, of yourself and even your family members, then of course we will be able to identify the deviation from the normal health. So in this particular unit, let us see regarding self-care. So self-care, as I have told, it should be the core of promotive, preventive, curative and rehabilitative care. The role of community health nurse is fundamental for empowering the people to implement self-care. That's why I told, as a community health nurse, we all are having a major role in empowering the people how they can take care of themselves. The health information may need to be demystified to make self-care easily understood by all people. So we should be able to give the health information or adequate guidance to the normal or general population so that they should be able to identify easily whether how they have to take care of themselves. So self-care should be a continuum of care with a developmental approach from birth through childhood, adolescent, adulthood and even elderly. When we tell about self-care, it is not about only the under 5 children or it is not about the self-care of an antenatal mother. It is throughout. It is a throughout care process. It is a continuous care in all the developmental aspect, like it should be in the childhood, it should be there in the adolescent period, maybe in the childhood the mother will be taking care of the child, but still during that time we should be able to impart the good habits in the child so that then only the child will be able to take care of themselves. The self care will be attained by the child only through the proper guidance, and even through the adolescent period and even in the elderly also we should maintain or we should be able to attain the old age people that they should take care themselves. At least they should be able to do their daily activities by themselves so that there is no need for them to depend upon others if they are able to take care of themselves. So even the expert also, they used to tell that the self-care is a translation of community participation. Self-care means one of the main principle of primary health care is community participation. We have to make them to involve into their health. because see, the health is in our hand. So if we are not taking care of ourselves, and if we don't know how to live in a good growth and developmental stage, then how come we will be able to participate in the overall health of the family and the community? So the community participation, we can tell the other name for self care. To strengthen the community participation, the first activity is the empowerment of women. So in the last few classes we were discussing much more about women empowerment. So in that we have seen that if a woman is getting more education, or if she is empowered, automatically a whole family and a community is getting empowered. So it will really help much more things in the self care of a community. So in this particular unit, we are going to see regarding the various aspects of self-care. So when we tell about self-care activities, it really include self, that means individual care, family care, group and communities. So some of the examples for community empowerment plans are like we have seen regarding national health campaigns. There are all India level health campaigns, health clubs are there in order to motivate the people to live healthier, and peer support activities like friend circle, old age circles. So in the same age group, because in the same age group they will be having more understanding, so they even accept also. If the same age group people talk each other, they accept whatever they tell, because always the generation gap is there between different age groups. So there will be an acceptance problem of educations when different age group people are talking. So that all should be, we should keep in mind in case of self care. So some examples for public policies, healthy public policies include establishment of health promotion funding. There should be proper funding for health promotion, that means for self care, and National Health Act, and Tobacco Consumption Control Act, and Alcohol Consumption Control Act. So these all are some of the examples in order to motivate how the public should maintain their health by themselves. So when we tell about health, self-care, it will be nice if we know one definition about self-care. So self-care in health is the behavior where individuals, families, neighborhood and communities undertake promotive, preventive, curative and rehabilitative action to enhance their health. So what do you mean by self-care? Self-care means it is a behavioral modifications, as I have told. So we have to change our behavior, or we have to mold the children behavior in a such a way that in a individual or in a family, or it can be the behavioral change in a neighborhood or in a whole community, towards what? Towards the promotive, preventive, curative and rehabilitative action to enhance their health. So the ultimate aim is health. So in order to attain the health for all, we have to change our behavior, health behaviors, towards promotive health, towards preventive diseases, towards curative and rehabilitative actions. So this is what is the definition given by WHO regarding self-care. So let us see how the self-care promotion we can do at the various levels. So when we tell about various levels, the first one is the central level. So the national and the subnational levels, how they help the individual to maintain their health through various policies or through various legislative support and adequate budget provisions for self-care plans. So there are, nowadays we all know that the government is providing various health plans or self-care plans to take care of themselves, to have various rehabilitative services, various home services, even so much of funding is available. That's why the budget is given more importance for self-care plans. Self-care interventions to be included in all relevant programs and project. As we all know, there are so much of small scale programs അല്ലേ, ചെറിയ ചെറിയ ഗ്രാമത്തിലൊക്കെ ഇപ്പോൾ ഒരുപാട് health related programs ഉണ്ട്, especially under the national health programs. There are various things which really support, even maybe to empower the women, economically supporting them, vocationally supporting them, rehabilitatively they are supporting them. So such type of funding and interventions will really help them to be have a self കെയർ അല്ലേ. സെൽഫ് കെയർ എന്ന് പറയുമ്പോൾ നമ്മൾ ശരിക്കും സ്വന്തം കാലിൽ നിൽക്കുക. അതിപ്പോൾ ഒരു ഹെൽത്ത് വൈസ് ആണെങ്കിലും, ഒരു ഇക്കണോമിക്കൽ വൈസ് ആണെങ്കിലും, ഒരു വൊക്കേഷണൽ അല്ലെങ്കിൽ ഒരു സ്കില്ലിൻ്റെ കാര്യത്തിലാണെങ്കിലും, വി ഷുഡ് ഹാവ് അവർ ഓൺ സ്റ്റേൺ. വി ഷുഡ് സ്റ്റാൻഡ് ഓൺ അവർ ഓൺ ലെഗ്സ്. ദാറ്റ് ഈസ് മെൻ ബൈ റിയലി സെൽഫ് കെയർ. So this is what government is supporting through national level. When we look into the community level, we can see there is provision for adequate funding to support self-care groups. There are various self-help groups അല്ലേ, നമുക്ക് എന്തെങ്കിലും ഒരു പ്രശ്നമുണ്ട് അല്ലെങ്കിൽ അത് സോൾവ് ചെയ്യാനൊക്കെ ആയിട്ട്, അല്ലെങ്കിൽ സെൽഫ് ഹെൽപ്പ് ഗ്രൂപ്പ്സ് ഞാൻ പറഞ്ഞതുപോലെ മേ ബി ഓൾഡ് ഏജ് ഗ്രൂപ്പ്സ് ആയിരിക്കാം, അഡോളസെൻറ്റ് ഗ്രൂപ്പ്സ് ആയിരിക്കാം, മേ ബി വിമൻ ഓർ വർക്കിംഗ് വിമൻ ഗ്രൂപ്പ് ആയിരിക്കാം, അല്ലെങ്കിൽ ആൻറ്റിനേറ്റൽ മദേഴ്സ് സർക്കിൾ ആയിരിക്കാം. സോ ദർ ഈസ് സോ മച്ച് ഓഫ് ഗ്രൂപ്പ്സ് നൗ എ ഡേയ്സ് ഇൻ ദ community level. Then adequate representation by women. So in all these areas, women should really have a representation, because see, women is the person which really she can communicate the things in the family. So family is the ultimate basic unit of a community. Then family and individual, the continuing education. So getting education in all the age, it is always very very helpful in the aspect of even health. നമുക്ക് നമ്മളെക്കുറിച്ചുള്ളൊരു ഹെൽത്തിൻ്റെ അവബോധം നമ്മളിൽ ഉണ്ടാവുന്നത് എപ്പോഴും നമ്മൾ എഡ്യൂക്കേറ്റഡ് ആവുമ്പോഴാണ്. സോ എഡ്യൂക്കേഷൻ ഈസ് വൺ ഓഫ് ദ മെയിൻ തിങ്. കണ്ടിന്യൂയിങ് എഡ്യൂക്കേഷൻ, ഹാവിങ് ഹയർ എഡ്യൂക്കേഷൻസ് ഓർ ഹാവിങ് മോർ നോളജ് അബൌട്ട് വേരിയസ് തിങ്സ്. ദെൻ സപ്പോർട്ട് ആൻഡ് ഫോളോ അപ്പ് ഇൻക്ലൂഡിങ് ദ സെൽഫ് കെയർ അഡ്വൈസ് ഓൺ ഡിസ്ചാർജ് ഫ്രം hospital. When we are getting discharged from a hospital or from a health center, of course the doctor or the nurse, they will really give us so much of health education. What is regarding the follow up, what are the supportive care we should provide at the home, when you should come for the follow up, so what all things you should do, the do's and don'ts in the various disease conditions. All these things we get the health education even from the hospital side also. So these all are the various levels of self-care. So self-care, we can tell the various level means the national level, the community level, and even from the individual and family level we can have the self-care aspect. So the various institutions for self-care promotions are like some of the examples they have given here. The services from local government and other relevant public sector offices, otherwise organizations, even the NGOs also, the non-governmental organizations, and various faith-based groups. Like we can tell about like temples, they have temple groups, church groups, so prayer groups, as I have told. So especially for separate intentions, they have various groups, self-help groups, because as I told, the same age group people, they can really share many things, and they can really solve various things, and the acceptance rate is also very high among the same age group. So multi-sectoral sectors also, like education field, information field, industrial field, and the media is also having a major part in imparting self-care promotion. See, like through various advertisement, even through television, through radio. Nowadays government is making the people to be aware about self-care. First of all, we should take care about our health. We cannot tell that only doctors, nurses and hospitals are taking care of the health. The first part is in our hand, that is self-care. So the first this is all about the introduction about self-care. Now let us enter into the next concept, that is assessment of self and family. How we can assess, how we can, in order to take care of ourselves or in order to take care of our self-care, we should be able to know how to assess ourselves. This is a portion already you people have studied in BSc third year under your child health. So regarding growth and development, so we should be able to know, or as a mother or as a female or as an individual person, we should be able to assess our growth and development, or our children's growth and development, otherwise our parents' growth and development. So how we can, so growth and development, it is both are two different things. There is no need for me to again teach you regarding growth and development. Let us have a quick discussion regarding growth and development. So what is growth? Growth is an increase in physical size of the whole body or any part or any of its part. That means, for example, the change in the size or in the length, that means we can tell in the quantitative terms, like it may be in the unit of increase in size, like in grams or kilograms or pounds, or when we tell about the length, we can tell the length has been increased in meters, centimeters, or foot or inches. So this is regarding the physical size increase, that is the growth. What do you mean by development? Development refers to a progressive increase in skill and capacity of function action. So here it is about the skill, improvement in the skill. Otherwise, what you attain in your life, what all skills you are learning day by day, that is about the development. So there are various factors affecting the growth and development of a child or an individual. So why we are refreshing this topic under this means, in order to have a self-help, self-care or self-help, we should first of all know how to assess ourselves or how to assess our family. In order to have an assessment under growth and development, you should know what are the various factors affecting the growth and development. So first one is genetic inheritance, like for example the skin tone or the hair color or the intellectual capacity. Many of these things we get maximum through the genetic inheritance. Then prenatal environment. So while the mother is pregnant, how was her nutritional status, how much of stress she has taken up, whether she was an alcoholic person, what all were her habits, all these things will directly influence the fetus and the child. Then undernutrition of a mother during pregnancy, the nutrition of the child, that means even the breastfeeding it involves, even after the breastfeeding, the weaning, how the weaning has been started, with what food the weaning has been started. These all things will really tell the nutrition of the baby. Then the age is also one of the factor which can affect the growth and development, because as we all know, the age, in each age they have to attain a particular height, weight, and even the developmental aspect also. So age is also one of the factor. Then gender, as we all know, the male and the female, or the girl or a boy, they have entirely different growth and developmental stages. The height, weight differences, and even the skills and even the masculine development, everything differs as per the gender. Then external environment, what ventilation we are getting, how much of fresh air we are getting, what about the housing conditions, the sunlight, all these things. The external environment, it is also having a major role in growth and development. Then various psychological factors, how was the parenting style, what type of parenting style the child has got, or the child parent relationship, and how the, whether the child is able to take up the stress, whether the child is able to tolerate the various pain in their life, whether the child is able to solve his or her problem by herself. So all these things will really, it is also one of the psychological factor which affect the growth and development. Then various infections, like it may be bacterial infection, it may be viral infection, it may be any type of parasitic infection. So in the younger age, especially during the younger ages, if the baby has any of such type of infection, it can really affect the growth and development of the child. Then economical factors, of course. So the socio-economical factor or the socio-economical standard of a child can really influence his or her health. Like a middle class family or a BPL family, really they have their own limitations. So like BPL family, really they cannot be able to think about the balanced diet always. So they just depend upon the staple food, and they just think about the basic needs. They give prior importance for the basic needs. So economical status also has a role in growth and development. And various other factors like birth weight, what is the birth weight of the child, what's the spacing between the child birth, their educational status, all these things have a direct or indirect role in growth and development. So let us see what are the principles of growth and development. While we monitor the growth and development, we have to understand some of the things. As I have told, it is already you have studied all these things in BSc third year. That's why I am just making you refreshed regarding these all things. So the various principles of growth and developments are, growth is an orderly sequence happening in systematic way. So as we all know, it's a step by step, it's an orderly manner. It's that's why the first principle of the growth is it's an orderly one, and it's a systematic step by step process. Rates and patterns of growth are specific to certain parts of the body. Big individual differences exist in growth rate. Growth and development influenced by a multiple factors. So you can read all these things. This is just for your basic information. We are reading this. Why? Because when you go to a community, you may get even a under 5, a small child. So you should remember some of the principles behind growth and development. So then only we can compare why the child is having less growth and development, which all principles were not attained by the child. So in order to know all these things, you should be able to refresh all these things. That's why we tell that in nursing all the subjects are highly interrelated, because community is such a subject. When you go out for the practical, you are going to get all age groups. It can be a small child, it can be an old age, it can be an adolescent, or it can be an antenatal mother or a postnatal mother or a newborn child. So all the age groups you should be able to deal with. So you should be always remembering the various principles of growth and development, and even the importance also. Here in this table they have clearly given the stages of growth and development. So here they have given in each age which type of phase they are: embryonic phase, fetal phase, neonatal phase, late neonatal phase, toddler phase, preschooler, schooler, adolescent, and even the adulthood also is divided into early adulthood, middle adulthood, and late adulthood, otherwise old age. So it will be good. I am very sure you all have studied this. Even in OBG also you will be repeatedly studying. Even in your child health also you have repeatedly studied, maybe in the medical surgical also. So that much importance you have to give for growth and development stages. And the importance as a community health nurse, why you should know about the growth and development. As a community health nurse, you should be always clear about what kind of growth and development changes to expect of the child at a given age. So when you go to a house, if you are getting a under 5, you should be able to know at this particular age what the child should attain, what is the normal growth and development the child should attain. Otherwise the community health nurse, she should gain the adequate knowledge on reasons behind the illness, why the child has got this particular illness. That's why the growth and development has been delayed. So we should have this basic knowledge. She can formulate appropriate plan for care for the given age. Then why we need to learn this growth and development means, when we are given with a child, we should plan the proper care for a particular age group, if it is a child or old age. So if you know the growth and development, then only we can really formulate appropriate plan of care for the given age group. And her knowledge helps her to educate the parents on growth and development in order to achieve optimal growth and development at each stage. If we are aware about this, then only we can really educate to the parents how they should monitor their child for the growth and development. So community health nurse, she has a vital role in assisting the parents to know what changes to expect during each stage of development. So I'm very sure that you all have studied the various developmental stages, what they attain in each of the age group. So after this unit, I would like to give you an assignment on the various growth and developmental factors. So what is the motor development, what are the various speech development, what are the various social responsibilities, what are the various developments attained at the given age group, starting from like from the first month to the 5 years, first month till the 5 years, you all should be knowing what are the various growth and development attained by a child. So these all things we are studying in this particular unit. We are just revising these things, whatever you have studied. I am very sure that you all are waiting even for the exam also. So it will be helpful if you can read all these things from the first month till 5 years, what are the various growth and developmental stages. So you all can write a small assignment on that particular topic, and once you come back to the college, you all can submit to me. So regarding the various developmental aspect of various child, starting from first month till the 5 years, in a short manner you can write, so that whenever you are writing assignment, never think that it is you are writing it just for a mark's sake, or you are just writing this for a teacher's sake. Always remember that it is for yourself. So write in a short form which will help you during your exam time, or for your knowledge sake you can write. Read the content and make it into points, and just highlight the points, and you can write the various developmental stages from first month to till 5 years. Next, let us discuss regarding the various measurements to assess the normal growth status. In order to assess the normal growth status, what all things as a mother we should be, or as a person, or as a community health nurse we should be knowing about. The first thing is regarding the height and weight. I am not going to explain much, because already when you write the assignment, all these things will be coming. Height and how to check the weight, These all things you should keep in mind. And weight and height increase, how it increases in each age, how much weight should be increased. So in this tabular column it is given, even you have studied this also. And regarding the head circumference, so even in the OBG also you will be studying in further. Already you have studied in child health also. So what is the importance of assessing the head circumference? So height, weight, head circumference, and tooth, when the what about the milk tooth, when it will be erupted, when the milk tooth will go and the permanent teeth will erupt. These all things are the basic things which we should know under the growth and development of a child. And even the pubertal growth also, at what particular age the child will be attaining the puberty, when they will be moving into the adolescent age, what are the bodily changes happening during the puberty for a female girl or for a male boy, what are the changes happening in the pubertal period. All these things we should be knowing. Then only we will be able to impart this knowledge towards the family or an individual. Then only they can really take care of themselves. So self care is one of the main basic aspect, so that if we know about all this growth and development things, then only you'll be able to take care of yourself and about your child and about the other family members in your family. So remember students, as I have told, the stages of development, from the newborn till 5 years, you all can write it as an assignment in a short manner. If you have any doubts, you all can call me. Otherwise the class representative can call me for the further instruction. Otherwise I hope the thing is very clear. You all can write the important things, various stages of development from the newborn till the 5 years as an assignment, so that you will be again brushing up your knowledge which you have already studied. So thank you students. In the coming class we will be continuing with the other aspects of self-care.